the first thing to know about post-traumatic stress disorder is that it's a normal response to an abnormal situation. It's a clinical diagnosis, but someone can have the traits without having the actual diagnosis. So the main characteristics of PTSD are that, first of all, there needs to be an incident or an experience that can be life-threatening or poses a threat of some kind to the person. And then we have 4 characteristics. First is intrusions and re-experiencing. So this is where we have experiences like flashbacks, reliving, sometimes intrusive memories of the event. Number 2 is hyperarousal, feeling on edge, irritable, easily startled, very anxious. The third one is avoidance and what we may call emotional numbing or even sometimes dissociation, which is a way of avoiding anything that reminds us of that difficult event, of what happened. And the fourth one is a change in beliefs, so negative beliefs about the self and others. For example, people may often find themselves blaming themselves, feeling guilty, feeling shame for what happened, and having quite a negative perception. So it's important to know there is something called watchful waiting for PTSD. So what we mean by that is that just because a traumatic event took place, for example, an accident or something else, it doesn't necessarily mean that the person will develop PTSD. So there may be a period between what happened and how the person feels in relation to that, when they may be experiencing some of the characteristics of PTSD, but these may naturally subside with time. So the person may self-heal in a way with time and with their usual support network in place. For that reason, it's good not to always interfere as soon as something bad happens, but to give it a little bit of time to see what happens. If the symptoms, if those difficulties persist, then there are a number of different therapies that can help. EMDR and CBT are the evidence-based therapies recommended, but there are also a number of other therapies that can help based on the person's presentation. It's also important to note that sometimes you may have some of those characteristics without a very clear traumatic event, for example. You may have a trauma reaction to things that may feel traumatic to you. So therapy may still be quite helpful in those situations.